Alrighty, my name is Sydney Grimes, and I'm going to be talking about problems within the foster care system and some solutions to those problems. So, the first thing I want to touch on are some quick facts. I retrieved these quick facts from state level data from an article titled State Level Data for Understanding Child Welfare in the United States from a journal titled Child Trends. First thing I want to look at is the age distribution of children in foster care. In the state of Missouri, we see that most children in foster care are between the ages of 1 to 5 at 33% and 11 to 15 years old at 26%. So children are entering foster care and they're going through the process of being in foster care at very, very young, important ages. And when we take a look at the foster care caseload in Missouri by race and or ethnicity, we see that 69% of those children are white, 19% of those children are African American, while 9% are Hispanic and or Latinx. When it comes to the case plan goal for children in foster care, Missouri is really big on reunifying children with their families at some point, eventually at some point. And you can see that that's the goal for children in foster care 63% of the time. And you see adoption is the goal 21% of the time, compared to other states at 55% and 28%. So the first problem I want to address is that the foster care system creates more trauma for children. Let's take a look at the foster care entry reasons. We see that the top four reasons children enter foster care is because of parental substance abuse at 50%, neglect at 41%, inadequate housing at 19%, and physical abuse at 16%. So children ages between 1 and 5 and 11 to 15 are going through these tough issues and they're experiencing all this trauma at such young and important developmental ages in their life, and they're not being taken care of gently. And when children go through traumas like this, it causes an increased risk of vulnerabilities and mental health problems if they're not addressed with trauma informed care, which we'll touch on later. This also causes placement instability and it creates a trickle down effect. So, if children are entering the foster care system, they're experiencing all these traumas and they're not being taken care of as gently, or there could be a more effective way that they could be cared for within the system, it's going to cause a trickle down effect. So not only is it going to affect the child, it's going to affect how they show up in their relationships, it's going to affect how they show up in the community, and that could eventually lead to poverty, crime, dependence on medication, a clinical diagnosis, and we see all of that within the ACEs study. And I received this information from children and adolescents placed in foster care and the need for trauma informed care within the foster care system, both journals from child welfare. And another reason why I believe the foster care system creates more trauma is because of routine screenings. A lot of times, screenings are done at the initial assessment, but they're not done all the way through their time and placement. Some solutions to this would be trauma informed care. The National Child Traumatic Stress Network describes trauma informed care as a practice in which everyone involved within an agency or service system develops and maintains an awareness of the impact of traumatic experiences on children, caregivers, and service providers. And that quote is from Bayerland and Bolock, 2014. So not only does trauma informed care take place just between the child and their worker, but it includes everybody in the systems, kind of like the family system that we talk about, but everyone. So it's the caregivers, the parents, everyone who works with that child is a part of this trauma informed care and has a very important role. In some ways that this will be beneficial will be what I mentioned before, routine screenings. Instead of just doing an initial assessment, we have to make sure we're doing constant and consistent routine screening so we know what these children are going through and how they're feeling in the moment and things like that, because how they feel at the beginning of their placement is not going to be how they feel in the middle or at the end. And we also want to make sure that we're doing culturally appropriate assessments. Every child who comes into foster care is not the same. We all have different cultural backgrounds. So when we're working with children, we really want to make sure that we're being culturally appropriate and being aware of their cultural differences from other children we're working with, as well as our own. And another way this would be beneficial would be because it analyzes the impact on the family system as a whole. So we're not just talking about the child, we're talking about the family system as a whole, how it's going to impact them with their family when they go out into the community and things like that. And also, it reworks with the child what it means to be a victim of trauma and what it means to be a victim going through this and how to heal and things like that. Because we can see that in Missouri, the outcomes of children exiting foster care, children are reunited with families in Missouri 45% of the time versus their case plan goal for children in foster care being 63% of the time. So we set the goal for children to be reunified, but it only happens 45% of the time. That's something that we have to work on. And with trauma-informed care involving the whole family as a whole, that's a number that can be improved on. So when it comes to ACEs, which I touched on earlier, which stands for Adverse Childhood Experiences, if you have childhood experiences and they're not taken care of with care and you're not receiving the proper care resources that you need to work through those, what is it going to lead to? It's going to lead to social, emotional, and cognitive impairment. This is what I talked about, the trickle-down effect. You can adopt health risk behaviors, which can then lead to disease, disability, and social problems, and then early death. So if children go through the foster care system and they're not being cared for, if they're not being taken care of gently and with care, and if our foster parents are not trained correctly or enough as they should, all of this has an effect. And eventually it could possibly lead to them being dependent on drugs or anything like that, more mental health problems, and it could all lead to early death. So a shorter life expectancy than what it would be if we would take the best care of them that we can from the very beginning. And the second problem I like to talk about is foster care parent training. So in Missouri, in order to be a foster parent in the state of Missouri, you have to have 30 plus hours of training to renew their license every 2 years. You can do 14 of those hours online. They're doing everything right now online, but if it was in person, you could do 14 of those hours online. And then to the right are just some basic requirements. So you have to be 21 years of age, no criminal or child abuse, adequate income, sufficient space in your home, financial verification, and things like that. But is that really enough for children who were 1 to 5 years old coming into foster care with all of these traumas? Is 30 plus hours really enough for a caregiver to have the skills needed to take care of that child in the way that they need to be taken care of? I believe that a lot of times that causes a lack of preparation for foster care parents, and things like social, emotional, and cognitive impairment, disease, disability, adoption of health risk behaviors can become more prominent if we're not adequately training our foster care parents to know how to show up for the children that they're dealing with or working with. Some solutions to that would be enhanced pre-service training. So from the article I read titled Treatment Foster Care Pre-Service Training, Changes in Parenting Attitudes and Foster Readiness from the journal Child and Youth Care. This article basically talked about enhanced pre-service training versus just normal pre-service training. So this article talked about, yes, this is theorized, but no rigorous study exists yet in order to back up this information. They did a study, but it's not enough to back up the idea that enhanced pre-service training is beneficial. So this study pretty much looked at, does this increase parenting attitudes, dedication, willingness, and licensing rates? So after this study, they learned that there can be a more positive change, that there was a more positive change in parenting construct, but there was no change in dedication or willingness, but there was an increase in licensing, which is good. So I believe that enhanced pre-service training is definitely necessary. 30 plus hours every 2 years to renew your foster license is not enough. We really have to enhance these pre-service trainings and make sure that parents are aware of the different things that they can deal with when it comes to taking in a foster care child. When we make sure that foster care parents are trained adequately on trauma-informed care, and they are really aware of what's going on with the children, how what they do, what they say, and how they behave can affect a child, then I believe we can start seeing better results and better outcomes in the state of Missouri when it comes to foster parenting and their outcomes. And that is all I have. Thank you.